everyone for joining us here today. We have critical information to share with our residents, and we want to make sure that you have the most up-to-date facts. Joining Mayor Jerry L. Demings and Mayor Buddy Dyer today will be Orange County Sheriff John Mina, Dr. Yolanda Martinez, Director of the Orange County Health Services Department, Dr. Raul Pino, Health Officer for the Florida Department of Health in Orange County. Now, after the speakers have finished, we will open this up for questions. So right now, I'd like to introduce Mayor Demings.
All right, thank you, Jane. Good afternoon to all of you. This is an opportunity to speak directly to our community and keep our residents fully informed on what is happening here within Orange County as it relates to the COVID-19 pandemic. Orange County now has reported cases of at least 50 cases here within our county of the coronavirus. On March 14th, just 1 week ago, we had only one case. It is an understatement, to say the least, that the virus is spreading rapidly within our community, and we want to take every measure possible to slow the spread and keep our residents safe and healthy. Several of those infected in Orange County are the men and women who really are on the front line. There are first responders, there are firefighters, law enforcement officers, TSA agents, and healthcare workers here within this community. Terrifying as it may be, this virus can be stopped. In a moment, you will hear an update from Dr. Pino from the Florida Department of Health here in Orange County. But first, I want to announce that I will be signing an executive order for a stay-at-home mandate for the entire county at the conclusion of this press event. This will go into effect at 11 p.m. on Thursday, March 26th, and continue for 2 weeks until Thursday, March 19th at 11 p.m. April 9th at 11 p.m. The order means that the entire county will be asked to stay at home as much as possible, with exceptions for businesses that are deemed as essential. Mayor Dyer will give more details shortly. I do not take signing this order lightly. Before coming to the conclusion that a stay-at-home order was necessary, I had a conference call with all of the elected mayors here within Orange County to hear their thoughts. Every mayor was deeply concerned about the welfare of residents here within Orange County. I also spoke with leaders from several of our hospitals, and I received their input. We believe this is the most effective way to deal with the coronavirus threat. I know this is uncomfortable for our residents, but our goal is to stop the spread and get life back to normal as quickly as possible. Already, the cases in Orange County have spread by nearly 500% or 5,000% in just a week. We really cannot afford to keep moving at that rate. We are here to help our residents through this, which is why we established a crisis assistance hotline. Our goal is to stop this virus from making and marching through our neighborhoods and into your homes. If we stand together as we stay apart, we will stop the spread of the COVID-19 in our community. I want to also address the flood of calls that we've been receiving into our crisis hotline. We understand that families are hurting in our community, and the critical need for these services are certainly significant. Over 100,000 calls were received to our hotline just yesterday, and we know that sometimes there were busy signals, but we're asking for our public to be patient in that regard. We've increased our hours of operation now from 8:30 a.m. until 4:30 p.m. each day. We've added call takers on those lines. So again, we're asking for the public to be patient in that regard. I want to remind our callers that this is a one-time benefit for 1 month's rent assistance for Orange County residents only. Appointments will not be given to county residents who remain on payroll from their employer. You must call for an appointment in order to receive assistance. If you need additional information, we're asking our residents to go to our resource tab on our website at ocfl.net/coronavirus. Again, the stay-at-home order is for the good of our entire community. It is countywide and affects all municipalities within Orange County. We must pull together while at the same time we're isolating ourselves so that we can flatten the curve and stop the spread of this deadly virus. We want you to know that our goal, again, is to get our lives back to normal as soon as possible, but we can't do it without the help of the public. And now at this time, I want to ask Mayor Buddy Dyer to come forward.
Thank you, Mayor Demings. I want to recognize your leadership and the leadership of the other mayors in Orange County. I want to thank Commissioner Burns for being here today, and I especially want to thank our local media for covering this and helping us to get out the message. Every single resident of Orlando and Orange County has an important role in stopping the spread of this pandemic. And as a city with our partners here in Orange County, we have a lot of difficult decisions we have to take action to stop the spread. A lot of people, as the doctors will tell you, that have the virus have no symptoms, or at the least have mild symptoms, but yet they can transfer and spread the virus not knowing that they carry the virus. And with the absence, or not absence, but the status of testing, we really have no idea how many people are infected in Orange County in Central Florida. And the longer we wait to take additional measures, the longer it is that we're going to have to battle with this virus. So we know that these decisions that we make, we don't take them lightly. They have economic consequences. They have emotional consequences. But we have to continue to act now if we're going to save lives. So last Friday, we had a phone conference with about 150 mayors that the U.S. Conference of Mayors conducted, mayors of LA and San Francisco, Chicago, talking about the spread, the most effective way to combat that. We subsequently talked together, the mayors of Tampa and St. Pete, about additional measures that we might take collectively together. Doing things as a region, or at least on a countywide basis, is important so that we don't have mixed messages and our citizens know exactly what the rules are going to be. Over the weekend, we explored these options with Orange County and with Osceola County. As Mayor Demings said, we sought advice from the medical community. I can tell you every single mayor in Orange County agrees with the action that we are taking today. The healthcare community has urged us to take this action. So Mayor Demings will be signing an order to tell our residents, to call on our residents to stay home, starting on Thursday and continuing 2 weeks. So that means that our residents should stay home unless it's absolutely necessary and essential to the health and safety of their family members or their pets. Now, it's still fine to go buy groceries, to get takeout, to walk your dog, to exercise, to pick up your medicine, to visit your doctor, or to get supplies so that you can work from home, as long as you do this while you're practicing social distancing, staying at least six feet apart. So this emergency action will order the closure of non-essential businesses like movie theaters, bowling alleys, retail shops, shopping malls that don't sell essential items in an effort to minimize the contact with their guests and employees. This virus doesn't spread, we spread the virus. So staying home means that together we're slowing the spread of the disease. We're reducing the potential overload at our hospitals that tell us they expect to have a lot more people coming in for their services. Ensuring critical resources for those that need them the most, helping reduce the stress on our healthcare workers who are already working around the clock, and further protecting our first responders. So this is absolutely the most effective method when we do it collaboratively. So I want to thank those mayors. I want to thank Osceola County. I understand that they'll be taking this up for consideration tomorrow morning, and I would encourage other Central Florida counties to consider a stay-at-home order suited to their specific needs in their county. I want to address just two other things. Homeless efforts. We were asked about that during the last press conference, and we are certainly not forgetting about the most vulnerable among us. Our regional efforts are being led by the Commission on Homelessness. We're ensuring that there is space made so that the appropriate social distancing can be accomplished in our current shelters, and we will stand up this week a dedicated shelter to those who are requiring quarantine. Our partners are providing access to showers, clean clothing, towels, and hygiene kits for people that are experiencing homelessness. And finally, I would just say, like every decision we've made, we don't take this order lightly. We know that it'll have an impact on our residents, but I know that the people of Orlando and the people of Orange County understand this and that they will take this to heart and do what needs to be done. Thank you. I don't know which doctor. Sheriff?
Thank you, Mayor, and good afternoon. First, I want to thank the residents of Orange County for their continued support and cooperation as we all deal with this public health crisis. All the steps that us as leaders are taking are meant to help save lives and slow the spread of this virus. So I want to be very clear about this. The Orange County Sheriff's Office and the other municipalities in Orange County do not intend to use this stay-home order as a mechanism to make more arrests. It's all about make sure people are in the right frame of mind, staying home so they can stay safe, so that we can stop the spread of the virus in our community here. And we just want our families to stay home and stop spreading the virus. Interestingly, we have seen a decrease in 911 calls by about 28%, and also all of our calls for service by about a decrease by about 20%. And the reason that is significant is because people are getting the message. So less people out in the roadways, less people out of their homes for different reasons is causing less calls for service. So people are heeding the warning, but now we're going to call on you again to take this order seriously, stay home, that we can all stay safe and stop the spread of this virus. So unfortunately, the Orange County Sheriff's Office is not immune to COVID-19. Last night, I was advised that one of our deputy sheriffs tested positive for COVID-19 after returning from an overseas trip. He had been in isolation, self-isolation, for about 13 days and has not been to work for the past 3 weeks. And so we know it's possible that there may be other cases at the Orange County Sheriff's Office family. We have contingency plans in place. We're very fortunate. We're a very large agency here at the Orange County Sheriff's Office. Matter of fact, with school being out, we have all these school resource deputies that are assisting our patrol functions out in the street. So we have plenty of resources to help keep our community safe. And I also want to remind people that you can report certain crimes online, anything that's not nonviolent, anything nonviolent, or anything that's not in progress. Just go to ocso.com. But if you need 911, of course we're there. If you see a crime in progress, if you see something suspicious, do not hesitate to call 911. So the days and weeks are going to be very challenging ahead of us. So we're just asking for everyone's cooperation to adhere to the stay-home order, and we'll all get through this together. And of course, the men and women of the Orange County Sheriff's Office and all the surrounding law enforcement agencies from the municipalities here in Orange County are here to protect and serve and keep everyone safe. Thank you. At this time, I'll introduce Dr. Yolanda Martinez.
Thank you, Sheriff Mina, and good afternoon to everybody. As we were getting ready for our press conference today, I was thinking a few days back when county partners were preparing for the possibility of cases, and we didn't have any case here, and I was holding my breath, and I was wondering how long would we be able to hold our breaths of not having cases in Orange County. But we have them, and hope is unfortunately not a strategy. The strategy that Mayor Demings is outlining for us as a county is what is going to help us to get out of this situation without much harm as other places have. I want to address the way the stay-home order signed by Mayor Demings is so critically important to containing the spread of the virus. Basically, it is an effort to enforce social distancing and prevent overwhelming our healthcare system. We talked earlier this week how the hospitals are limiting visitors and elective surgeries to deal with the influx of COVID-19 patients and to protect the health of those already hospitalized. The order is aimed at residents, but especially our vulnerable populations. We want our seniors and immune-compromised residents to stay home to avoid possible contact with individuals who are carriers of the virus. For everyone else, please stay home as well, except to get food, to get care for a loved one, to access your healthcare services, or to go to work if you're not allowed to work from home, if you don't have that possibility. Under the order, it is okay to go outside for walks, for runs, for hikes, to ride your bikes, but not to do it in groups. Please do it by yourself or in distance, at least 6 feet away from the person who's accompanying you. A stay at home means staying inside. Please follow the CDC guidelines and be attentive to the messages that are provided by the media on a regular basis to keep alert of what's going on, what changes are happening in your community. And what I'd like to read now is a message from Darrell Toll, President and Chief Executive Officer of Advent Health Central Florida Division. He has this message for all Orange County residents. Staying at home and practicing social distancing have been shown to be effective measures to curb the spread of COVID-19. We must do all we can to protect our community and, importantly, our physicians, our nurses, and other healthcare workers. And I think we've all been witnesses to what we have been seeing in the news of the different communities that have been tremendously affected by the virus, and we've seen those healthcare workers there on the front line trying to save lives, and their lives in turn being placed in harm's way. So we're asking the community to please listen and heed this advice and stay home as much as you can to protect yourself, to protect your loved ones, to protect your community. And with that, I'd like to introduce Dr. Raul Pino, Health Officer, Florida Department of Health in Orange County. Thank you.
Good afternoon. Thank you very much, Dr. Martinez. Let me start my statement with, it's never too late to fight this. So we should not give up because we have a few more cases. And when I say a few, I don't mean to diminish the significance of reaching this number. But remember, we have 1.3 million people in a larger metropolitan area. We can fight this. This community has been through worse than this recently, and we have come out very good. And we will do it again, and we will do it together. So with that, I also want to thank my employees at the Department of Health in Orange County. Without them, I will not be able to do the work that I'm doing. And to report to you that we started yesterday doing testing at Saya Lafayette. The numbers are not high, and they were not intended to be high in the first few days while we work the in and outs of doing testing. The community may not know, but doing testing is not just collecting the sample, it's how you collect it, how you transport it, where it goes, what temperature have to be. So there are a series of things that go behind this. Yesterday we did 9 tests, which is very low, and today we're doing 13, which is a little bit higher, but not what we want it to be. Our capacity there would be around 50 a day, and I can double that capacity to 100 a day if I have the resources on the background. To tell you also, our department and the county, we are not sitting on our hands waiting for the supplies to come from the state and the federal government. Although we have put those requests through, we are frantically working around the clock, trying to find resources, whatever they are, to bring into our community. And we may have some success in the coming days in bringing some sampling for testing. With that, I also want to tell you, as the mayor mentioned, we have 50 cases, 50 officially cases. Yesterday was the highest number of cases in one day that got reported to us, 13. And the youngest person in our county is 20 years old, and the oldest person is 87. We also have a few hospitalizations, 12 in total. And we have a resident of the county that is not in Florida at this time. It's outside the county. We also continue to plan for the possibility of having a drive-through testing in case that we get the resources that we need to do so. And in due time, we will inform if we open a drive-through for the community. In that case, it will be a large number of testing done in one single day, and we hope to sustain it for a few days. Our strategy has to be to, what the Mayor Buddy says, is that we are the transporters of this virus. We are the transmitters. We are the one moving around. We have to limit our mobility as uncomfortable as it can be. And the safe assumption in this environment, I'm going to say it again, is that everyone else has it. Even if you have a negative test today, it doesn't mean that you cannot acquire the disease tomorrow. So that's what is so critical to reserve test kits for those who need it the most. And that's why our criteria is so stringent. But although we have seen a pickup in the number of tests ordered and performed by private doctors in independent practices, and that's encouraging because, again, all the private labs in the state have the ability to do testing. Doctors have to order and collect the sample, and no criteria is needed. But again, the doctor have the conditions in their office to be able to collect those samples. With that, I believe I pass it to Mayor Demings.
Okay, thank you, Dr. Pino. We'll open it up for questions at this time, but I do also want to acknowledge our Orange County Commissioners. We just finished our Board of County Commission meeting just a few minutes ago. And they stand with me in making decisions in the best interest of the health and safety of our community. So with that, any questions that you may have, we'll go to the front and then we'll go over here.
Mayor, the governor has been saying the last couple of days that a stay-at-home order did not make sense for the state of Florida. What specifically made sense about it for our community?
What makes sense for it in this community, we have a collaborative effort. We have consulted with both our medical healthcare professionals in this community as well as the other first responders and the business community, and we believe this is the right solution for our community. While the state of Florida is enormous within this urban county, we have seen the numbers increase significantly within the last few days. And so our concern jointly here is that we want to stop that. We want to stop the spread of it. We believe that the faster we can stop it, the sooner we can return to some sense of normalcy here in this community.
Was there a piece of information from the hospitals that made you think this was the right decision?
Well, we have to lean on our healthcare providers and experts, and they gave compelling arguments to me, and it was real simple, that if you want to stop the spread, you need to create the distance, you need to create a change in our social norms where we are not congregating together. And if we do that, we go through the pain of doing this for the next few weeks, we should see positive results. Keep in mind the fact that tomorrow we're slated to begin the mass testing at the Orange County Convention Center, and that operation will be run by the state of Florida. As Dr. Pino's Department of Health here in Orange County ramps up its ability to increase the number of tests that they will be doing, we know that once testing occurs, we're going to get additional numbers. So what we're trying to do was the hospital professionals were saying to me that we want to get in front of any type of surge that negatively impacts the ability of our hospitals to be able to care for all of our community. And so this is why it is urgent that we take the actions that we've taken today. Okay, I'm going to go to the back and then I'll go to you, sir.
How will this be enforced?
The question is, how will it be enforced?
Yeah, so much like the curfew, so we're not out there looking for people who are going to be violating the curfew or violating the stay-home order, but we are going to be, especially those people who are in large social gatherings or some of those non-essential businesses that are just blatantly violating the order, we are going to take a look on that. And we're going to warn people. We're not just going to throw the handcuffs on people. We want people to adhere to the order, but we're out there to provide safety and security for everyone. And again, this is not a mechanism for us to make multiple arrests. Just like with the curfew, you're saying few to little arrests on that. It's going to be the same for the stay-at-home order. We're asking the people of Orange County, both the residents and the businesses, to adhere to the order so that we do not have to take any type of enforcement action. We want people to stay home and stay safe. I believe it's a $50 fine, punishable by 60 days in jail.
Okay, we're going to go to yes, sir, Channel 6.
Oh, sorry. I'm getting bombarded with questions as we sit here, sorry. You talked about residents and businesses for this. What about people who are coming in from the airport? And we understand, at least as of today at the airport, still not a lot of testing being done, but people arriving from those high-risk zones.
We do have the airport executive director here, and they've laid out some additional protocols at the airport, and so why don't I ask Mr. Phil Brown, the executive director there at the airport, to come forward. He can talk to you more about what's happening at the airport itself, and then we'll go into some of the other questions.
This afternoon, we, in conjunction with the executive order issued by the Governor DeSantis last night, started support of health officials who were processing passengers and getting information on airplanes from the tri-state area, New York, Connecticut, New Jersey. We got the personal protective equipment this afternoon, so we're able to start that implementation. That is being directed by the health department and those officials. They're being supported by 10 National Guardsmen, and then of course we have Orlando Police Department Airport Division that is supporting them from a law enforcement standpoint. We haven't had any incidents whatsoever at this point, and so they are processing passengers on those flights.
Okay, and I think the question was over here.
Sure.
Yes.
So does this mean that residents cannot leave the county, and how do you enforce when people are coming in from counties that don't have the mandate?
It doesn't mean that residents can't leave the county, but there may be some circumstances that warrant them being able to leave the county. But while they're in the county, we're asking those of our residents to stay at home. Those who are not essential businesses or individuals who are not part of the emergency response team to also stay home if there are workers that are not enumerated. I will tell you that there are a number of individuals who are exempted under the statute, too many for me to get into it at this point, but we will provide a copy of the order to you that allows for those who need to move within the community to be able to do so. Individuals, as Mayor Dyer said to you, if you're still able to go and purchase your groceries and other items, but we really don't want you lingering out in the public. We want you to really be more confined to your homes. But we understand that people sometimes get cabin fever. We've seen that happen during hurricanes, and we know that at least with this order, it has the right balance where individuals can go outside in small groups as individuals to exercise or what have you. But beyond that, we're basically saying stay close to your homes, stay at home.
Schools are feeding children who are needing food during this time. Are school employees considered essential staff?
If they're in support of the mission, if you will, in some way, those individuals would be considered allowed to move throughout the community itself. Okay, I'll go to the back and then I'll come back for it. Yes.
Mayor Demings, I want to ask you a little bit about the rent assistance. I talked to several people who cannot get through on the phone line, who have called hundreds of times. What are you guys doing to, increase that capacity? And is it possible that you guys are going to set up a website so people can do that instead of call?
There was a meeting of our staff today to really look at better perfecting that system of being able to get assistance. So we're increasing the number of staff devoted to that effort. We're increasing the number of people who will be answering the phone lines, and we'll be certainly looking at the technology that can be deployed to assist us in working with the citizens. What I would say to them is that just continue to contact us. We're going to continue taking calls for the next 2 months regarding this. So I understand that for some people they need an answer now, but we are there. We're willing to assist up to perhaps 1,500 people during this period of time. Our Board of County Commission was briefed on these efforts earlier today and had many of the same kinds of questions that you asked, but I'm very confident that our staff will be able to develop a workaround to meet that need.
What is the budget on that, and is there a possibility for other programs that aren't?
At this point, it's about $1.8 million that we are devoting to this effort during the next 2-month period of time. Okay. Question?
While we're on there, is the media exempt from this as well?
I'd like to say no, but the media, I think we rely on you all to assist us in delivering the messages to the community. So yes, the media will fall in that category.
I mean, you were talking about people outside exercising and so forth, but I'm thinking about people going to Lake Eola or going to the parks. Are these people going to be asked to leave and go back?
There are, I think Mayor Dyer can address Lake Eola in terms of what the city of Orlando is doing specifically with that, but in unincorporated Orange County, our parks are essentially closed. They won't be able to congregate there because, again, we know that this is uncomfortable, and we're asking our residents to be uncomfortable for a couple of weeks in order so that we can get more comfortable in a short time thereafter. Okay, I'm going to go to the front.
And Mayor, you said you spoke with a lot of the healthcare professionals at the hospitals in our community. What are they telling you about their bed capacity, their workload right now, the supplies and PPE they have? Where are they at?
What they're saying to us is if we do not manage this process now, they'll lose control over the ability to be able to manage it in the short term. And so we're taking those actions. I think what they're saying to us is that they want to have the decision-making authority over surgeries, health care within their facilities, and that's a decision that we say is between the physician and the patient. We're not trying to interject ourselves in the middle of common sense health care decisions that need to be made. So we all have the best interests of the health and safety of this community together. So it is a collaborative, and we came to this point today because we talked to all of those different constituents within our community.
Sure.
Okay, I'm going to go to the very back wall. Okay.
Where the folks who are coming in from New York, where are they self-isolating? I don't know if you or Phil can talk about it. We also have a lot of empty hotel rooms. Is that being used maybe for folks self-isolating or maybe the homeless population?
You know, I have no way of knowing. I don't think we have any way of knowing where they're going at this point. Phil, from the airport, do you have any idea where they're specifically going?
Part of the questionnaire that they fill out tells they're supposed to disclose where their location, where they're staying. It's, if you think about it, it's similar if you've flown in the old days when you had to fill out paper declarations and where you were staying when you were on immigrations. The same kind of process. So those locations are known. That's been filed with the health department, so they know to follow up with them at those locations.
Dr. Pito, you talked about doing sentinel testing. Did that begin? And how many locations did you go to? And what have you found?
So I will not know the results for a few days until they are back from the lab. The Sentinel study was done today, and in coordination with the State Health Department, we decided to do it in assisted living facility or long-term care facilities, although our concern is with the most vulnerable population. And having the experience that we had in Washington State, we don't want that to repeat in Florida. So what we have done, we selected 5 assisted living facilities in the county, and 10 random voluntary tests were done in each facility. and those results will be sent to Jacksonville lab for results. When I know the results, we will let you know.
Thank you. The President said today he thinks the economy could be back up and running by Easter. Any thoughts on that?
I hope he's right. None of us know, but all of these measures are being put in place to hopefully get our economy back running as soon as possible. Okay. Question. We'll go to him and yes.
Kind of jumping off of that point. If the President moves forward with what he was saying by April 12th, are you comfortable saying the measures you've been knowing, or could that kind of force your hand to kind of walk into the fact?
This has been a fluid process that we've been in, and to me, the decisions that we make is based on the information, the data that we're receiving at this time. If miraculously something happens where those numbers end up not increasing daily, then certainly we would take that into consideration. There wouldn't be a need to, but the odds are truly not in our favor that is going to happen. Okay. All right.
Pretty quickly. Can you tell me why the 2-week time frame? Like, where did we get that from for the stay-at-home order?
We have looked at what has been done in some other metropolitan communities, and we wanted to be somewhat consistent in that regard. And we thought that if we went to a 2-week period of time, it was a reasonable period of time to see and measure the potential results. And we can, if we need to go longer, we'll extend. If for some reason we have to shorten that, we certainly would do that. It's not likely that that period of time is going to be shortened, though.
Enrique, Commission meeting, it was mentioned that the county is currently in negotiation with a couple of hotels for the homeless population. Can you talk a little bit about that?
Well, we're having those conversations. We're trying to look out for that demographic within our community, that being the homeless population itself. When we say stay at home and you don't have a home, what does that mean? So we are trying to make certain that we meet those needs as well for the short term. Okay. Yes, sir.
While we've been in here, Universal Orlando announced they're not going to stay closed till the 19th, the week after Easter. We haven't heard from Disney yet. Maybe you've heard something we haven't, but just your thoughts of this community being shut down even longer than expected and the economic impact and the jobs tied to that.
I believe that we have broad support for the action that we've taken today. Many of those corporate partners that we have here in this community, they were in agreement with this action. So, okay.
Dyer, you had mentioned last week about someone in the homeless population testing positive. Do you have any indication of any other people testing positive?
That's all I know of is that single case, Dr. Pina.
That is correct.
Yeah, just the one case. And we're standing up an area that will be able to isolate people that exhibit symptoms, and we're taking precautions to make sure we social distance within the existing shelters that we have.
Is that person already isolated somewhere?
That person went to the hospital.
Mayor, do you feel like you have enough supplies, safety supplies, like gloves, masks for first responders?
The answer is no. We are in the system for the state supplies, and there's not enough in America. There's not enough in Florida, and there's not enough in our community. Okay.
Question for both mayors. What conversations, if any, have you had with neighboring counties about the stay-at-home order, and would it be helpful to have more buy-in from if they were to do this?
Well, I believe that you will see Osceola County, at the very least, adopt the same order, similar order, and they will likely make that announcement this evening or in the morning, perhaps. But we've been in communication with them. Will the other counties do so? I think it's driven based on the numbers that we're seeing in our respective counties, but it would be nice if throughout the entire region they join us in this effort. Okay, the young man in the back. Okay.
And Ryan, sometimes Orange County, Orlando are the leaders on some actions that are taken and give other communities cover to take the actions that they need to take. So I think by us taking this first step, it will probably encourage some of the other neighboring communities to do that. We do know Osceola's going to act on it tomorrow. I think Pinellas County may act on it tomorrow. They're not exactly neighboring, but they're a similar county to us.
Can you clarify what are considered essential businesses?
Okay, that's a long list, and so I'm going to ask the county attorney. He's done a lot of research in this effort, and so I'm going to ask him to come forward. He has the information right before him. The county attorney here in Orange County is Mr. Jeff Newton.
There is literally a laundry list of essential businesses that are considered essential businesses. In fact, even laundromats are considered essential businesses. And all of these businesses that are considered essential are basically businesses that will enable individuals to continue to conduct their lives as they have been, but practicing those social distancing measures that the Centers for Disease Control has recommended. So you're going to receive a copy of it. I'm not going to stand here and go through the 40 some odd lines of all the essential businesses, but you will see that basically businesses that are deemed essential will be able to carry on their activities, but yet practice those social distancing measures, which will help to decrease the transmission of the COVID-19 disease.
We have been following it. Precisely, I haven't done the math today, but between the business that was canceled at the Orange County Convention Center and our hotels, when we put the two together, it's probably $1 billion impact, negative impact on our economy at this point. And that number, of course, can climb each day because there are smaller meetings and the like that are being canceled as well. Okay. All right, one last question.
One more on the rent assistance. So do you guys know how, when you put in place, how it's going to work? Do you cut a check to the person or do you work directly with their landlords? Because, people see the opportunity for fraud.
Okay, the question is on the rent assistance, and do we write the check to the individual or do we write it to the rentor? Yes, the check is written to the landlord, and there's a process that we have to go through to validate, the need for the individuals. There are certain things that we will require in that process. And by the way, we do have crisis assistance for even utility payments as well. And these are programs that existed here within Orange County, and we are simply expanding those programs to meet the current need. So again, thank you all very much. We are going to get about signing the order at this time.